Hello friends, today we will discuss about the ovary cyst. In the women of reproductive age, ovary cyst is nowadays becoming very common. Why so? Because the race of life, which earlier women used to be away from that, very few women used to get exposed to that. Now it has changed, ratio has changed. Now more and more women join the race of the life. The soaring ambition of the teenage girls to get academic achievements, to get best living amenities, best clothes are required, best job is required. In order to get best of everything, they put a lot of pressure on the mind, which increases the stress level of these teenagers beyond the limit, which makes them vulnerable to get hormonal imbalance, and thereby it results ovary cyst. So in a single sentence we can say it is a lifestyle disease. It is found that 35% of the Indian women in the reproductive age suffer from ovary cyst, and out of which 40% they get type 2 diabetes by the age of 40. Diabetes also is a lifestyle disease nowadays. Even though such a greater percentage of the women suffer from this disease, the impact is so huge, but unfortunately 70% of the women suffering from this disease, this problem of ovarian cyst, they remain undiagnosed because lack of awareness about the symptoms of the ovary cyst. Number one. Number two, the conventional system doctors say if ovary cyst is there, there is no treatment for that. So just leave it like that. It's not going to harm you. These are the two reasons why they remain undiagnosed. But that is not true that it is untreatable or incurable or it doesn't need the treatment. The fact is that it has to be treated. It is of course an abnormal growth. So that has to be corrected, unless otherwise it will lead to more grievous problems. So if simply we leave the ovarian cyst like that without getting cured, then what will happen? There is a big problem. If it starts in the teenagers, then it may lead to the complications like infertility. Even in some cases, it may lead to cancer-like problems. It may bring the parallel hormonal imbalances like thyroid abnormality. So thyroid abnormality, the common manifestations we have mentioned here: abnormal hair growth, excessive facial hair, then hot flushes, weight gain, then lack of appetite or too much increase of appetite, ravenous hunger, menstrual irregularities. All these are the symptoms. Above all, the problem after ovarian cyst is that since the woman remains irritable inside, internally she is not in a calm, quiet state of mind. She is in a disturbed state of mind. So that irritability, it gets expressed externally. So the living surrounding of the woman, that remains disturbed. So the entire family life gets disturbed. So it's high time to know what are the symptoms of ovarian cyst, whether we have those symptoms. If such, then we must get it diagnosed properly and we must get it rectified. Before knowing the symptoms, we should know what are the causes of ovary cyst, when we can suspect that we may have the ovary cyst. Number one, the family medical history. The mother, the grandparent, grandmother, the sister, if they had the ovary cyst like problem, then we are also susceptible to likely to develop ovary cyst. Number two, if we are under great amount of stress, we are not able to cope up with that much of stress. Number three, the sedentary lifestyle, that is improper food intake, shift-wise duty the women who are doing, no time of sleeping, no time of eating, that always get disturbed. So whatever we get, we junk food, etc., keep on eating just to fill the stomach. So this type of lifestyle, if continues for a prolonged time, that also considerably contributes to ovarian cyst. Next, how to know whether we have ovary cyst or not. This is very important. Number one is a premenstrual syndrome. Most of the women having ovary cyst, they have this. 2 to 7 days before of the mens, there can be the symptoms like excessive irritability, anxiety, anger. There can be heaviness in the breasts, bloating of the abdomen, loose motion before or during menses. All these things will calm down once the flow starts. So many women think it is a part of the life. It happens like this. It is normal. But the fact is that it is not normal. Number two, abnormal facial hair growth. That is technically called hirsutism, where you have male-like hair distribution. The women used to get mustache, beard on the face. So they run to the parlor, get it shaved, so that after 15 days again they may have to run, and slowly they find that the need of shaving is becoming more and more frequent. Said behind the fact is that they have some hormonal imbalance which they were not unaware of. Number three, abnormal appetite. The appetite is totally gone, or there is a ravenous appetite, excessive hunger. As soon as you eat, immediately you feel like eating something else. Always you feel like eating. There is an all gone sensation inside, empty sensation in the stomach. Immediately you need something to eat. This is the abnormal appetite. Before menses, the appearance of pimples, acne. So this is an important symptom of hormonal imbalance, where the skin reflects internally you have some problem. That is why externally the pimple keeps coming before your periods, before the hormonal menstrual flow starts. So these are the symptoms which we should not neglect. Then depression, anxiety will be there. Abnormal menstrual flow. Normal flow is 3 to 5 days. If it is less or more, then it is abnormal. Then male pattern hair fall from the scalp of the woman. The male, the scalp will have alopecia. Alopecia from the two sides, not from the center. From the two sides the hair will be going out, the balding will happen. So that is called male type hair fall. So these are the important common symptoms. If any woman gets these symptoms, then she may suspect of having ovary cyst inside. How do I confirm whether I have ovary cyst or not? Ultrasound, the scanning of the lower abdomen, confirms the diagnosis whether you have it or not. So technically there are varieties of ovary cyst: follicular cyst, corpus luteum cyst, hemorrhagic cyst, and dermoid cyst. So which cyst I am having, how to know? Just for the awareness, I will tell you, on the 14th day of menstrual cycle, if the lady gets a sharp pain on one side of the lower abdomen on 14th day of the menstrual cycle, Lower abdomen is the place of ovaries. Two sides of the lower abdomen, two ovaries are there. So in which side the cyst is there, that side on 14th day the pain will be there. There is a sharp pain and that will subside just after some time. So there we can expect the follicular cyst. Then number 2 is the corpus luteum cyst. This cyst absolutely produces no symptom. So you cannot know until unless you get a scan done. The doctor will only diagnose this. Number 3 is hemorrhagic cyst. This is the most painful and most dangerous cyst a woman gets. Here what happens, the cysts keep on bleeding inside itself. And the pain is excruciating type of pain on the sides of the lower abdomen. So the pain is unbearable, shooting type of pain, and ultrasound again has to be done to confirm it. And if it prolongs for a long time, it may lead to anemia like things, and it's one of the dangerous type of cysts. It has to be treated without any second thought. Number 4 is dermoid cyst. Dermoid cyst means sometimes the cyst inside the ovary form some other tissues, like some fatty tissue will be there inside the cyst, or some bones, some hair, which are the abnormal content of the cyst. So these cysts are again confirmed by the MRI or CT scan. So this is called dermoid cyst. Irrespective of the type of the cyst, the treatment of the cyst has to be done. That is a compulsion. Treatment, what kind of treatment is necessary and what kind of treatment is right for the ovarian cyst, we must know. If not, we are suffering from this disease. It may happen that any of our blood relations may suffer tomorrow. So the knowledge of this cyst is essential and is a must for every woman. Now first we'll see in the conventional system what kind of treatment it offers. In the conventional system, absolutely there is no cure to ovary cyst. If it is in the mild form, where the cysts are in the very minute form, so that stays, many of the conventional system doctors, they will say it is quite common, leave it as such. Once it grows and reaches to a bigger size, finally they will tell now it is the need to go into the surgery. So just we have to cut it out. But that is not the solution. Why the cyst has formed, that cause has to be treated. If not, then today we will do the surgery, cut it out, and tomorrow again it will form. Then how to prevent that? Prevention is essential for the cure also. In conventional system, what type of treatment they give before it goes to the surgery stage is that if you have irregular menses, they will give you the oral contraceptive pills to regularize the period. You take such and such tablets for 21 days and leave for 7 days. Again, you start for 21 days, like that. So many of the women who take these pills, they think that I am on a good way of treatment and I'll get cured of my problem. But unfortunately, after 6 months or 1 year of taking those pills, when they stop it, after 2 months or 3 months, again the symptoms are back, because the cause remain untreated. The supplementary treatment which the conventional system provides here in the form of hormonal tablets is not at all the cure. Rather, we can say it's an adding of fuel to the fire. Already there is a hormonal imbalance. On top of that, you provide some more hormonal pills. Now coming to the other system, alternative system of treatment for ovary cyst. Yes, we do recommend this system of therapy for ovary cyst, because without doing any surgery externally, with the internal medication itself, it has the capability to dissolve the ovary cyst. Not only that, the cause of the ovary cyst, the inability to cope up with the stress, that also gets addressed by the alternative system of therapy. So homeopathy has a promising treatment for the ovary cyst called constitutional treatment. So the qualified homeopaths, experienced homeopaths get give very well treatment for such cases. With a duration of 3 months, 6 months or 1 year, it all gets cleared and the recurrence also is very well prevented. So that the teenaged girl who suffers from this disease gets very much clear for the further occurrences of the reproductive system in her life. Here I will give you some of the common homeopathic remedies. Number one is thuja. In my practice, I have used it very commonly for the ovary cyst, where I am being guided by the symptoms of excessive weight gain with the irregular menses in a teenage girl. Especially the left side of the ovary develops the cyst. During periods, the pain will be there in the left side of the lower abdomen. Sepia, usually in the menopause time, I have used it frequently for the women. There is a premenstrual syndrome. The lady is quite unpredictable. What she will do at what time, nobody knows. She catches cold easily. The mood swing is too big. So that guides me to prescribe sepia. Sulfur. Sulfur has a great indication. There will be acne before menses. The acne will be a glandular type of acne. Pimple will be painful and a big redness will be there. Sometimes pus will be formed, unhealthy skin, and infertility also will be there due to ovarian cyst. And in both side ovarian cyst, it is very much efficient in curing. Calcarea carb. This we prescribe when the fat deposition happens around the waist. The obesity becomes more around the waist. The rest of the part of the body remains as usual thin. Usually the vitamin D deficiency will be associated with that, and calcium level also will be less in the blood. With the investigation we find out thyroid abnormality will be another association. So in that case I have used calcarea carb very frequently. For more detail visit drmeeta.com. Thank you.